عليكم كانت تكون برقة جشكانة برجانة شمان مغربي أنا إيفن جانا تانوس تيبرنتد Assyrian Wellness Collaborative قبل مشانك كل خامنوخون ودي أتلن خاخورز الرابع شابيرة دي لنايا كما لبتت depression همزميات of depression anxiety and mental health ما لبتت سلاماتوي تتموخة كيوت خافارة خالد على أبيتون أمان كتريسات ينطلاسات دابيلا هم زمانه أسيت لشانت جانن لشانت إنجلس هبدا دانا دابيلا licensed social worker بتشاهد منوخون جانوخون كلبتوخون بريشايد جوانكن خاماتن جيلي مش ميتون على خورزة سبب خورزة لكد رابا كماسا يلبخ منو خالد على ملبخ كخينه احنا نوديو جميع كيو هالت جراند اوك هال كيو مديت تورلاك هرت خدمري خورزن مشاره من ساعت اسرا بهلگی هل تری بار کاوترا دابیلن کاوترا این اسپرت دیانی لکت اتیتون لپرانا جامیتون جودا خورز دیان شریکیتون منن. Good morning, my dear friends and fellow Assyrians and Americans as well. My name is Janet Atanas. I'm the chairperson of the Assyrian Wellness Collaborative. I would like to welcome every single one of you to join us on this wonderful occasion. Today we're celebrating mental health. We will be talking about the issues of mental health, anxiety, depression, and so on. We are blessed to have physicians, licensed social workers, as well as county representatives, the sheriff, and the police department as well, and quite a few medical clinicians that would be with us continuously. Our program will start at 10:30 a.m. and it will continue to go on until 2 in the afternoon. There will be a lunch. Lunch will be provided, and this event is all free for everyone to come in. We are gathered at the Grand Oak Hall in Turlock, and I would love to invite you to come in and join us. And as I said, let's celebrate this beautiful day to honor mental health and to work on it, to understand it, and to be able to learn and to teach others. I want to thank you for listening and hope to see you. Thank you so much. Goodbye.
Thank you all for being here. We are running a few minutes late. We're waiting for a few people to arrive. Thank you all for being here on a Saturday morning. I think we all deserve a round of applause for those who got up to be here on Saturday. Welcome to the beautiful Grand Oak. My name is Carmen Morad. I am the co-chair of the Assyrian Wellness Collaborative. We are so excited to have this community convening. We have community leaders and stakeholders that you'll hear from today. We have youth groups. We also have SACAR and Big Valley and different agencies and departments that you'll hear from. Let's begin with hearing a few welcome words from Mrs. Janet Atanos, the chair of the Assyrian Wellness Collaborative.
Good morning. I'm Janet Atanas. I would like to welcome every one of you to this wonderful day. Today we are going to be blessed. We will be celebrating mental health. Mental health is an issue that affects every single family. Personally, I have had opportunities to have met some people with mental health issues. However, we are here to learn and to teach, and also to be able to accept what is going on, because we're all in this together, and we're all God's children, no matter what. So it's a pleasure for me to be here and to welcome every single one of you. I would like to say a few words in Assyrian. Shalom aleichem yishkane shamane muhibbe parjane muhibbe. Ana even Jana Datanus. قبول مشانه که کل خامه نخون که ودی پقدتون لخا بتابیلن خاخورز رابا شابیره دیلنایا خاخورز کد منو یلپخ وبزمل پخ خورز دیان بتابه بود همزم تابود أمارد موخة ين mental health وديو إخنا بايخ celebrate أو دخل mental health سبب أمر appreciate من بار مرض كوفيد رابا تيلي كو بتفات ديان كو كلبت ديان كو دوست ديان سو لا نخبخ همزة مغباسو وبزاوة خريط خدمري شمانة وملبانة قد خايمة إن تبتلن بخابر سوبا قد اتلي تشاتونويتا ناراهتويتا بدا مارا إخلن أمسخ أبا خيرانة مدرك أبو المشانيكي كل خامنوخون خلت مريالا خايمة رابا شابيرة باسيمة داويلن كلن ميدالة وبز الشكل على لها قد جدا أطرائيبخ من كاونتي كديان هايورنا من كاونتي اتلن سبورت من شيرف ديبارتمنت من بوليس ديبارتمنت من كل دكانات حكم دا كاونتي قديم تاتي بتهيري بس علىها برخاني إلى بيانتين كما تابيتون منن خلت مريالا بد مبسميتون من خرزة أوديو أبيتون رغا بسيمي كما شميتوه.
I'd like to welcome Mr. Carlos Cervantes with Stanislaus County BHRS, PEI, and also our MHSA manager. As we get ready to hear from our presenters, I would like to invite each and every one of them to please come up here to introduce themselves. Please come up. We have Sakar. Please come up so you can make your introductions. Every speaker that we have, Jennifer, and you, of course, with Nami, please come up to the podium so you can make your presentations. And while we wait, I will briefly go over the agenda with you. We are so blessed to be working with our state senator, Senator Mary Alvarado Gil. As soon as our introductions are done, we will hear a message from her. Next, we will hear from Donna Linder, Stanislaus County Voter Registrar and Clerk Recorder, a dear friend of the Assyrian community. After that, we will hear from Dr. Arlene Yahyabake, who is a physician here and has been in... we have collaborated with her with a few of our Assyrian Wellness Collaborative programmings. Thank you again for taking time out to be here. After that, we will hear from the St. John Assyrian Presbyterian Church Youth Group. Very excited to have them here as well. And then Dina Malek-Moreno, licensed clinical social worker. Dina is one of the co-founders of the Assyrian Wellness Collaborative, and it is a privilege and a pleasure to always be learning from her. She has a thriving private practice here in Turlock. After that, we will break for lunch. And at 1 o'clock, we will hear from Yamilet Villadolid, Director of Government and Community Affairs at Golden Valley Health Centers. And after that, we will have a panel which we will hear from other stakeholders, community leaders, and our Sheriff Jeff Dirksey. Thank you again. And we're going to begin with our guests who are here today. Come on over.
Good morning, everyone. I'd just like to introduce our group. We are in the Stanislaus County, and we are the Stanislaus Asian American Community Resource, and for short, we are called SACAR, to make it, so you don't have to go through the whole long name. So my name is Annie Thu Henrich. I'm from Vietnam, and I'm the president of the SACAR. So we have been part of BHRS. We started in 2011. We are a nonprofit organization, and what we do, we advocate and help translate for all the Asian API, meaning from Vietnamese to Cambodian, Lao, Hmong, Chinese, the Philippines. So we have all the languages in our group. All our members speak all these languages. So just to let you know, if you need some translation or somebody to advocate for your client or your customer, please come by our table and visit us. We will be very happy to help. I'm also on the mental health board. I've been the Stanislaus County Mental Health Board for the past 15 years before I even joined SACAR. Mental health is very important to all of us, especially in our Asian community, because a lot of us are families of refugees, and they came from Vietnam War countries that were devastating. Some of them lost a lot, their family, their everything. So we are here to help, and we are nonprofit. So all of our members are all volunteers. We don't get a salary. We don't get paid. So right now, I would like to introduce you to our members. So yeah. So this is her name is Bác Ngô Huỳnh, and she is a member since the beginning as well. What year was it that you joined? 2012? And she is our treasurer. And she also from Vietnam. So next, this is Miss Lisa Smith. Lisa, Vietnamese name is Miss Hoa. We call her Lisa, make it easy. And she joined about 2 years ago. She's a very active member, very active and help us. We did 3 years in a row, we did vaccination, a COVID-19 vaccine for our community, API community and everyone else. We got almost 2,500 people vaccinated against the COVID. So they were very, very, yeah, thank you. Yeah, so they're very, very appreciated for their support. So our next member is Leroy Smith. Leroy, I'm sorry, I forgot to tell you that Lisa is also from Vietnam. So you look at their beautiful dresses. We are wearing our traditional outfit called áo dài, which is very typical that Vietnamese lady will be wearing. Sorry, Leroy. So Leroy is Lisa's husband, and he's also a very active member of our group. He's been helping us with a lot of work, just to set up vaccination clinic. We had to work like from 8 o'clock in the morning until 4 o'clock in the afternoon, and there's a lot of things to carry and talking to people. So Leroy, thank you. And here we have Tay Kang. Tay, you are related to Lisa and Leroy, and he is just joined us about a year ago, a very active member as well. Thank you, Tay. And here's the most important person in our group. He's our accountant. His name is Mr. Tri Huyen. So he handles all the money. When we have grants, he does all the financial report and everything. So without him, we would not be able to function well. So thank you, Tri. And I just want to let you know that we have about 15 members, very active members, our core group. And we also have another about 20 out in the community. So please visit our table. We're here to a little bit of, publicity for who we are, because a lot of us don't know we even exist. So thank you so much. Have a good day. Thank you, Carmen.
Hi, I'm Dar from NAMI Stanislaw. We're the nation's largest grassroots organization that provides support and education for the many families that live with mental health conditions. I'm the president of the board. I coordinate all of our programs, and I share the PEI program. Lisa and I coordinate it together. We have education classes. We have support groups. Our support group meets every Monday night from 6:30 to 8. We have a family support group. Everything's online. And we also have a connection support group for those that are living with a mental health condition. There's no registration required. Everything we offer is free. We do mental health presentations in middle schools, high schools, colleges, to the general public. Yeah, we offer family-to-family education classes. It's an 8-week class for those that have a loved one living with a mental health condition. And we do that online throughout the whole year. And it's amazing. It can be life-changing it is life-changing for many of the individuals that take it. We do Ending the Silence presentations to middle and high schools to help educate our young because so many of our students and our young people are living with mental health conditions. They have symptoms, but they don't know what they are, and they don't know that there's help out there. And the students are very open to that in the colleges and to the general public, and businesses are in your own voice presentation is amazing. The video is 8 individuals sharing their journey through their mental health condition, along with 2 of our NAMI presenters. And it gives everybody encouragement and hope that no matter how bad it can get, there's always recovery, there's always hope. Okay. Come visit our table. We have a lot of information about all the programs we offer and about mental health conditions. Thank you.
Good morning. My name is Jennifer David. I'm a school psychologist for a local school district and also one of the youth group leaders at St. John's Assyrian Evangelical Presbyterian Church. We will be presenting on the role of faith in mental health as well as in the Assyrian community. I'll be joined by 2 of our youth group members, Lucas and Adelia. Thank you.
Hi everyone, good morning. My name is Yasmin Martinez and I work with United We Dream California. So we're the largest immigrant youth-led organization in the country. We are bringing resources from some of our work that we've done, cases around deportation, mental health, and a lot of different work. So definitely check us out. We do work with immigrant youth, so regardless of their background, we provide all those resources and trainings and development. So feel free to check us out. And then if you have any questions as well. Thank you.
Good morning. My name is Carlos Cervantes. I'm with Behavioral Health and Recovery Services. I'm the Mental Health Services Act Manager. I appreciate the opportunity to be here, hear this discussion, and hear the different resources. I think it's important that we have a conversation around mental health services, especially in those communities that might be on the marginalized side, to make sure that we are outreaching and that they know of the services and that they know that mental health is something that we need to speak about and talk about. So appreciate it, and thank you for everyone that's here, and I'm grateful for all the agencies that are collaborating. Thank you.
Thank you, Carlos. Now we will hear our message from our senators, State Senator Marie Alvarado Gil.
Hello, everyone. My name is Senator Marie Alvarado Gil, and as we observe Mental Health Awareness Month, I am honored to share with you an important initiative. The Assyrian Wellness Collaborative, in partnership with Stanislaus County Behavioral Health Recovery Services, Prevention and Early Intervention, is steadfast in its commitment to reducing the stigma of mental health and raising awareness of the significance of well-being in the Assyrian community. Their approach emphasizes cultural competency and sensitivity to guarantee access to care is available when needed. The hope is to identify these barriers and work together to create meaningful solutions to serve individuals who are at risk of serious mental health issues and their families as well. Thank you for your participation and willingness to make a positive difference in our community.
Good morning. I'm Donna Linder, County Clerk Recorder, Registrar of Voters. And I wanted to talk to you today about voting, which by voting, you make your voice heard. You vote for representatives that think like you, that will put policy in place to assist with what you're here for, mental health issues. Just like the senator that we just heard from, you voted her into place. So I'm going to really start with more like a history lesson of the United States, our nation, and it's not always positive. So when our nation first started in 1790, the only way to become a citizen was a Naturalization Act was passed, and it limited U.S. citizenships to white immigrants, only from the European nations. You had to have lived here for 2 years, and it also said that your children, if you were out of the country, they could be citizens. So a civil war broke out in the United States, and after that, President Abraham Lincoln, he decided that we have to change the Constitution to make things better. So January 1st, 1868, it's 5, the 13th Amendment was passed, and it abolished slavery. So that was what the war was for. But with this, Frederick Douglass, a minister, said that the best way to to abolish slavery was only if the black man had a ballot, so only if they could vote. Abraham Lincoln, unfortunately, April of 1865, was assassinated. So that meant that his successor, Andrew Jackson, became president. Andrew Jackson decided that he'd let the states decide how they were going to rebuild their government after the war. So in the southern states, they put in a law that they called Black Code, which prevented black citizens from having all the rights that all the other citizens had, and it denied them the right to vote. So radical Republicans in Congress were outraged. They said that these codes really reenacted slavery. So in 1866, Congress passed the Civil Rights Bill, the 14th Amendment, granting citizenships to all persons born and naturalized in the United States. In 1870, Congress passed again a 15th Amendment about voting rights, that they could not be denied to United States or states on account of race and previous conditions of servitude. These were only for men. So this seems like, okay, great, now everybody has the right to vote. But unfortunately, within these laws, there were loopholes that left the door open for some of our states to make qualifications to vote. So they put into place literacy tests, poll tax, and other discriminating things to prevent people from voting and disenfranchising the black voters. It wasn't until 1965, this is some of in our lifetime, 100 years later, that the Voting Rights Act was put into place, banning literacy tests and other methods to disenfranchise voters. So in 1969, 61% of the eligible African Americans were registered to vote. That's 3 times the amount previously registered. So even though there was laws that said they could vote, there was always something preventing them. It took 100 years for them to have the right to vote in our country. When we came to this country, America was settled. There were Indian tribes. The government called them indigenous tribes. They had a self-governing act that they already had in place when we came here. So we prevented them from getting U.S. citizenship and the right to vote. It took them 136 years to obtain the right to vote. They started by fighting state to state because the government would not allow them. And when you get the right to vote in a state, that means you can only vote on that state's issue. You cannot vote on anything federal. So they worked state to state to become able to vote in each state. Some states did the same thing to the Native Americans. They put in place poll tax, literacy test, things like that, that prevented them from voting. It was not until, again, 1965, when the Voters Act went into place, that the Native Americans actually had the right to vote on state and federal issues. America was a male-dominant society. Women also were denied the right to vote. They did not have the right to own property. They could not claim the money that they made even. So they were just expected to do housework. In 1848, a movement started to begin to start getting women's rights. In 1869, one territory, not even a state, they weren't a state yet, allowed women to vote up to the age they had to be 21, and that was in Wyoming. They became a state in 1890. With this movement, in 1890, Senate and Congress would not allow women to vote. They just kept denying it. So women, again, just like the Native Americans, started going state to state to try to get the right to vote. By 1918, 19 states had granted them the right to vote. And this caused Woodrow Wilson, the president at the time, to say, you know what, maybe we should look at this again. So he proposed something to Congress to allow women the right to vote. It failed. In May of 1919, a congressman named James R. Mann again proposed the Susan B. Anthony Amendment granting women the right to vote. It finally passed. It passed both the House and the Senate. But to become federal law, 36 states had to agree with this. The northern states all said yes. The southern states said no way. It left it down to one state, Tennessee. Tennessee voted. They were at a tie. One more congressman to vote. Story has it that his mother called him and said, "You need to vote yes." So I don't know if that's true. But he did vote yes, and women were finally granted the right to vote. Unlike our African American voters and our Native Americans, women did not face the same complications, and November 2nd, 1920, 8 million women voted for the first time. This took 72 years for women to get the right to vote. Even though the 19th Amendment was federal law, the states that didn't vote yes still had to ratify it. They allowed women to vote, but they didn't really like it. They didn't actually vote yes still on the 19th Amendment. It took 60 years for the remaining 12 states to vote this into place, even though they followed the law. The last state, Mississippi, did not ratify the 19th Amendment until May 22nd, 1984. So, in our lifetime, these three groups have been granted the privilege to vote, the rights that they were denied all those years, 100 years, 136 years. People have fought in this country so hard for us to have the privilege of voting right now. It's so easy for us. In Stanislaus County, we do everything we can to be inclusive, to make it easier for you, have options to vote. And it is so important. The women had the right to vote based on one vote. One state, one congressman allowed that right to vote. So every vote is so important. In Stanislaus County, we have seen this recently. Recently, a Turlock school board race last November won by one vote. So that board member is there by one vote. We just had a special election in March for Oakdale School Board. It ended in a tie. One more vote would have decided that race. So make your voices heard. Be part of the decision making of who represents you on your school boards, your city councils, your county councils, your supervisors, your assembly, your Senate, and Congress. All of you have that right as U.S. citizens to come out and vote on anything that would make your lives better. We do have a table that will answer any of your questions if you have them about voting. Thank you.
Thank you so much, Donna. It's also important to let everyone know that Assyrian Americans in Stanislaus County can actually vote. We have these facsimile ballots in Assyrian, or Syriac as it's called. Thank you, Donna, and your incredible staff. So it is important to vote, to have a voice, to be able to make your voices heard. Thank you again for that education and that presentation. It is now a privilege and an honor to introduce Dr. Arlene Yahyabake for her presentation. Let's welcome her, everyone.
Hello, everyone. Thank you so much for having me here. So I will be discussing mental health and the barriers and obstacles that mental health has in our healthcare system. Before starting my presentation, I just want to say I was very happy to hear about how there is support for mental health and how our refugees can get some more support from different groups, and how important it is to inform everyone that these helps are available. So many times the obstacles and barriers are the fact that we are not aware of all the possibilities and all the help that is available. And that is very, very important and one of the mainstay of the mental health. Especially if we know that the help is available, we won't feel that we are limited or we are the only one dealing with mental health. So I chose 3 references for this subject. So I went over 3 articles. The first one is like a very big study that studied 50,000 people, adults, to see what are the barriers to the healthcare access in the U.S. And the other two studies are working on teenagers and young adults, and to see what are the barriers that are actually stopping them from seeking help for their mental health. And the most important one, the last one, was addressing the stigma, which is the biggest problem when we are talking about the mental health. So one thing that is coming off of the very first article is they sort of decided, instead of naming it as mental disease or mental problem, name it as psychological distress, which is a better way of addressing the problem and the better way of getting the stigma away from this discussion. So I just want us, all of us, to go through this as a practice, to sort of feel what this article was all about, and to see how actually this mental health is related to each one of us at every moment. So I just want you to think, in the past 30 days, which one of these feelings did you experience? Sadness, nervousness, restlessness, hopelessness, worthlessness, or feeling like everything is a big effort to make it happen. Now, you see, each one of us at any moment may have experienced these feelings at some levels. Now they are using the questionnaires to see how severe those are, and scoring that. I'm not going to go into details of that, but putting that as normal psychological distress, medium psychological distress, or severe psychological distress. Again, emphasizing on the word psychological distress. When we're talking about this, it just feels very normal. Like all of us, we know that, every day, today I may be more distressed than the day before, or tomorrow I may be even better than today and not having distress. It doesn't feel a burden of this is a disease or this is a problem. So now let's go, see what they did to see what the barriers are. That one. So they did ask people to answer these questions. And again, I would want you to please think to yourself to see which one of these questions you would answer as yes and no, and which one of these has been the struggle for you. So the first question was, is there a place that you usually go when you are sick and you need advice about your health? If your answer is yes, so that is like approachability, that is like things are available to you. And the same approachability goes to, have you delayed getting care for any of the following reasons in the past 12 months? You couldn't get through on the phone. You couldn't get an appointment soon enough, which is availability. Once you get there, you have to wait too long to see a doctor. The clinic and doctor's office wasn't open when you could get there, and you didn't have transportation to get there. All of these, I think some of you will answer yes already, huh? Isn't these like the complications that we already have? If you get sick or have an accident, how worried are you that you will be able to pay your medical bills? And how worried are you right now about not being able to pay medical costs for normal health care? So these are the questions about affordability. So during this study, they realized so many of the patients are dealing with these obstacles. Even if they are feeling the need for asking for help, they would need to overcome all these obstacles. And as healthcare system, this is our responsibility to work on these. work on accessibility, work on approachability, availability, affordability, and acceptability. And it is very important to be the care that we're providing to be appropriate. Meaning that I added these two, considering my own people, Assyrian community. Like the language barrier and the culture barrier are very, very big and distinctive problems that makes it hard for our patients to ask for help, and makes it less appropriate for them to go to a doctor that cannot speak their language or they cannot understand the culture. So all of these are the barriers that we are facing. The results of these studies were the lower rates of the usual source of care among male people, the younger adults and Hispanic people are just like, it seems to be much less. And this is like cultural, like male are trained not to show their emotions. And so many times when it comes to actually voicing their struggle and mentioning that they need help, they prefer not to do that. And they hide it until so many times the distress is very severe. Younger adults, I will go over that most of them, they don't even, as they mentioned, they don't even know what the symptoms of mental distress is. And that's one of the major reasons that they don't seek help, or they feel that they can handle it themselves. The other thing is one of the major barriers that were discussed is if the patients have paid sick leave from their works. So many times we do not seek help because we cannot have days off of work, and we prioritize working over our health. Not getting the appointments soon enough is one of the major problems, and as a doctor, I'm already dealing with this problem. When we need to refer our patients to higher level of care, sometimes the waiting time is up to 6 months. So that is definitely a point that medical system has to work on it and try to improve on that. And in urban and rural areas, we have like more problem. This is like unfortunate, but the reality. And then, and the worst outcome was, as I mentioned, seen in this people who are having less access to the healthcare in the rural area, and male people and the minority. But the protective measures that were making it better for the patients, and the patients was helpful for them into mental health if they have a partner, if they have a dependent, if they do have paid sick leave from work. And the most important one was earlier detection and diagnosis of the health problem. And just considering it as a chronic problem rather than mental disease. Now, the other thing was the young adults, which is, I'm like very excited about this part. Because about young adults, so many times when it comes to our medical system, we doctors, we sort of brush off their symptoms. This was an interesting study because they asked the teenagers to actually write down what they think and how they want to be talked to. And so many times they mentioned that when they go to doctors and they explain their symptoms, the symptoms are being not considered severe enough, or they feel like the doctor didn't take them seriously. One thing that we should recognize is teenagers, they do not have the emotional maturity to deal with their emotions yet. So many things that they may mention, maybe for us as adults is just easy, not a big deal, but for them, this is a very big deal, and this is a challenge for them to overcome. So when it comes to healthcare system, when we are working with teenagers, maybe an extra training and extra attention to the details, and more recognition of the fact that every challenge for them is just big, and they need to feel like heard is very important. So how to help young adults include emotional competence like personal belief, internalizing gender norms, coping skills, and self-efficacy, and the stigma in back of your mind when you're talking to them, because all of these are challenges that they have. Acknowledging them is the most important thing that they kept emphasizing on. Positive attitude towards seeking professional help, like putting it in this words that, especially as we mentioned, as putting it as this is distress, this is not a disease. Even just like taking that label off of the mental problem helps a lot for the teenager to be open to the idea of seeking help. Social encouragement, exactly what you guys are doing, which I definitely appreciate. The fact that if we do talk about these problems and they see, okay, this is not something weird, everyone are talking about it, my colleagues are talking about it, my friends are talking about it, everyone are open to this fact that maybe sometimes you are more distressed than before and you may need help. So that can help a lot. And the other thing is availability and establishing a trusted relationship with professionals, especially general practitioners. And I'm a primary care physician, so we are actually the people who mostly deal with this depression and anxiety in the clinic. And we are the first line of defending people and introducing them to the fact that this distress and depression is not a disease, but you can overcome it. And that's why it is very important to establish a good relationship with our patients. And actually, it's maybe very helpful the fact that we can, as primary care physician, I would see all the family members, parents, children, and even grandparents in the clinic. That makes a trusty relationship with the family, and that makes the teenager to feel safe to share the information and to mention the struggles that they have. So that even makes the role of the primary care even more important in this matter of mental health. So reasons why teenagers do not seek help is, first of all, stigma. The thing that matters the most for them is just they are so scared of being stigmatized. Then discomfort about talking about mental health problems. And they are constantly think they can do it themselves and they can rely on themselves. So that's very important. When I'm reading these articles, I think, okay, if I'm talking to a teenager, as parent or as a doctor, I should get them involved in the process of getting better, for them to feel that they are in charge. This is very important because they are constantly thinking they don't want to seek help because they want to rely on themselves. Now, if we allow them to be involved in their own improvement and care, this will have better outcome. The other reason that they don't seek help is failure to perceive the need for help. They do not recognize what are the symptoms of being sick, and sometimes saying, maybe I'm not sick enough to go and seek help. And top-rated problem is just teenagers, it seems they believe no one can help them. So that was one of the top-rated problems that they mentioned. The other things that is in smaller communities is a problem and barrier is confidentiality. So many times teenagers do not open up, and this can be actually for other adults too, not only teenagers, but they don't open up because they think that their information won't be kept confidential. And like the doctor knows my grandma, so may say something. The nurse would know, my auntie would say something. So so many of these are the other reasons that teenagers are not seeking help. Lack of accessibility, as we mentioned, time, transport, and cost. And I did touch base on this, that they don't like being labeled as sick, and they feel that they constantly, when they talk to the doctors, they minimize their problem and trivialize and ignore the challenge that the teenager is facing. And to sort of wrap it up, the most important part of the mental health is stigma. So now the last study was only about stigma. Stigma can be understood as 3 levels, actually. Can be social, structural, and self-stigma. Structural stigma refers to policies and practices of institutions that systemically restrict the right and opportunity for people living with mental health disorder. I would go to the voting problem that we were mentioning, the same way that it took us years and years, up to 100 years, to overcome voting problem. This is the same thing. When it comes to being depressed or being challenged with mental health, there is some still policies and regulations out there that limits the accessibility, limits the amount of things that person can do in society. So that is a reason that people would try to hide the fact that they are dealing with mental health in the fear of being eliminated from the society in any order or problem. So this is definitely something that will need help and work on, but hopefully not 100 years. And the social stigma refers to the process whereby social groups endorse stereotypes about people and stigmatize against them. So, I think we are very familiar with that already. That we do label people as some different labels and then eliminate them, and we don't want to hang out with them, we don't want to be around them, and all this. And people who are dealing with mental health, they feel that, and they don't want to deal with that, so they would rather not to seek help, not to be labeled as sick, not to have to deal with all of these problems. So we see how stigma is like very, very important here. The other stigma is self-stigma. When the individual, they realize that they do have this mental disorder, but they don't feel like themselves, and they feel like if they accept that they are sick, so now they are not perfect as they used to think they are, and they should believe that they are not able to do everything. And so the value that person has in mind about themselves goes down. And that's why they don't want to accept the label of being sick in order not to feel bad about themselves and not to feel that they lose their confidence. But what to do to decrease the stigma? The very important thing is viewing a diagnosis of mental illness in the same context that you would see a diagnosis of physical diseases and physical illness. The same way that you wouldn't blame someone for cancer, the same way that you wouldn't blame someone who has cancer and now they are constantly tired, they are constantly moody. You don't blame them. But if someone is depressed and now they are moody, they are tired, and they are not willing to engage, now we blame them. So nothing's wrong with you. Why you're not engaging? Why you are acting so moody? But if we see it at the same pattern and seeing that this is a disease, and that way we won't be like judging the people who are dealing with mental disease. Starting point to reduce stigma includes changing the language we use. Exactly the opening word that we used here. Instead of saying mental disease, we used emotional distress. So that takes the label off, and that takes the pressure off, and makes it like easier for people to believe that it is okay to seek help. The third one is with school, talking about mental health openly, and education. Exactly. Again, thank you. You guys are doing amazing. I didn't even know about you guys. And that's one of the best ways of like reducing stigma and allowing people to recognize that it's not a big deal to feel distress at times, especially after COVID. Unfortunately, we do see a very increased number of depression, anxiety, and even suicide attempt, and even in way young ages. And teenagers are dealing with this problem way more. So now I'm emphasizing on these problems and trying to solve it is very important, even more than before. The other thing is increasing access to the mental health and improving accommodations at schools or work or everywhere that possible for them to be able to take days off. And that will help them to seek help more. The other thing is just the teenagers didn't like going to doctors because they were saying they were not able to get any service if they don't get a label. A label of, now this person is depressed, now this person is anxious, now this person is this, that. And so many times, again, just labeling is the reason that they don't want it. So what they suggested to help with this is just to start the intervention way sooner, and do not label it as anything, only mention as this is distress, so let's work on it. And even start the treatment and counseling way sooner before it gets to moderate or severe mental distress. Start when they are in mild mental distress. Try to educate them at the time that they don't really feel sick and they don't feel that something's wrong with them. If we start the intervention then they won't get to the moderate or severe mental distress. And then at that time, slowly, they don't feel stigmatized. And because it was mild enough that we couldn't really label it as this is depressed or anxious, again, it helps for them not to feel stigmatized, not to be labeled, and seek help more. So this is the end of my presentation. And I hope that as a society and as a mental health system, all of us can work together to make this happen, because this is a necessity, especially now after COVID. We have to come up with good plans to deal with mental health. Thank you.
Thank you, Dr. Arlene Yahyabake, for your tireless efforts for the well-being of the Assyrian community. Basam Taraba. I'd like to ask Jennifer David to please come up here. We will hear from her regarding youth, which is something that Dr. Arlene talked about. It's so important to hear their experiences, and I'm hoping our leaders and stakeholders here will get more information, and hopefully the Assyrian Wellness Collaborative can be that liaison.
Good morning. As I mentioned, my name is Jennifer David. I'm one of the school psychologists at a local school district, but also one of the youth group leaders for St. John's Assyrian Presbyterian Church. Here with me today is Odelia and Lucas, and they're two of our youth group members.
Our history of St. John's City in 1925 was established.
So as he mentioned, we were established in 1925. We were the first Assyrian church in California. We serviced the Turlock and San Francisco regions, where we had 10 families who came to church.
In 1942, we aided the Japanese Americans.
From the very beginning, our mission was to provide support and a sense of belonging, not only for the Assyrian community, but as well as our local communities. So in 1942, when Japanese Americans were placed in internment camps in Turlock, our church stepped in and we actually cared for their belongings and their property until they were released.
Today at St. John's Assyrian EPC, about 240 families were members, different groups, and committees.
Over the years, our church has formed different committees and groups to help meet the needs of our Assyrian community in all aspects of life. For example, we have our youth ministry, and our main goal is to create a safe and caring environment where our youth can come to help get their needs met for any challenges that they may be facing. We also want to help break the stigma surrounding mental health so that they do have a better future.
Our youth group, we have 7 youth group leaders.
That's right. We have 7 youth group leaders who all come from either education or educating the youth ministry. And as our goal, as I mentioned, is creating that safe and caring environment.
We have 25 to 30 youth group members, weekly meetings, and various lessons.
Our various lessons help the youth not only build a connection with God, but also learn to trust God in all the decisions that they make.
Fellowship activities.
Our fellowship activities are offered to our youth to help foster that caring and safe environment that we're trying so hard to create. It is important to understand what it is like to live as an Assyrian in America. According to the 2009 U.S. Census Bureau, there were over 100,000 Assyrians living in the United States. In 2017, it was estimated that there were 35,000 living in Stanislaus County.
Living as an Assyrian American, advantages, faith.
God comes first in the Assyrian community. We were actually the first nation to decide to transition to Christianity. And so it's not a surprise that all Assyrians, or most Assyrians, are Christians. This is why we turn to our church to help us through any struggles that we may be facing. In the last 2 to 3 years, over 100,000 individuals from different countries have actually watched our services and our Bible studies through YouTube. And we're extremely grateful for that when we had the COVID-19 lockdowns and some of our community members felt socially isolated and weren't able to connect to others from their community.
Family.
Assyrians are very family-oriented, so living in a country where we can go and come freely helps us feel grounded and gives us a sense of belonging.
Traditions and customs.
As I mentioned, we are very rooted in our faith, and so this is how we help keep our traditions and our customs alive.
Equal opportunities.
Our ancestors left everything behind in their birth countries to come to a country where they have the freedom to practice the religion of their choice, and they have the freedom to go to school regardless of their gender. They're able to come here and try to live the American dream.
Disadvantages, ancestry.
Although we have a lot of advantages, there are some disadvantages. Assyrians take great pride in knowing that we are one of the oldest cultures and all that our culture has contributed to society. However, some of the individuals in the Assyrian community suffer from generational trauma. From coming from war-torn countries and from the Assyrian genocide, where an estimated 250 to 750,000 Assyrian Christians were massacred by the Ottoman Empire. This is why having our church and having a sense of belonging is so important, and it's something that mental health professionals need to keep in mind.
Escape persecution.
Many Assyrian immigrants came to the United States to escape persecution, and these hostile living conditions are carried with us as we come to this new country, and they can impact our mental health as well as the mental health of our future generations.
Language barriers.
As it was mentioned earlier, we also struggle with language barriers. Many of our elderly don't speak English, and so it is difficult for them to get their wants and their needs met. But we're also finding that our first-generation immigrants are having to interpret for their family and their parents, which adds an additional stressor for them. They're making important decisions for their families at a very young age, and it's switching that role of the parent-child relationship.
Traditional values.
Assyrians have very traditional values that are tied to their faith, and sometimes these values can be difficult for non-Assyrians or for our youth to understand. For example, it's very common for an Assyrian to live at home with their parents until they get married or they move away for school or work. But regardless of their age, however, this can be hard for non-Assyrians to understand, and it's viewed as very odd or strange. And then our youth also view our values as being archaic, and they don't understand why we practice such old school values. That's why we try to create that safe environment at our youth group so that they do feel comfortable coming to us to share any challenges they may be facing.
When in need, on him cries, the whole body joined, and held together by every supporting ligament, grows and builds itself up in love, as each part does its work. Ephesians 4:16.
Research shows that when we experience a traumatic event, the most important thing that we can do is turn to somebody who's caring and trusting. This individual has the power to help us build resilience and overcome that traumatic event. So for the Assyrian community, those people are often our clergy or our church family. It's not uncommon for someone who is struggling to turn to their pastor. He's someone who's safe and who's able to maintain that confidentiality that she had mentioned. But he's also able to connect us to different resources in our community. We turn to our church family to help pray for us and help guide us. And just like when somebody is struggling, we each play our part. Just like the body has different parts that work together to support the whole body, we too play our part to support the person who is struggling.
Experiencing grief or loss. Americans' celebration of life. Assyrians mourning the loss.
How mental health challenges are processed can vary based off of our culture. But regardless of that, we all experience grief and loss. In the American culture, they grieve the loss, and they're sad, but they also celebrate that life. Many times they won't have funerals, they'll have several celebrations of life, whereas in the Assyrian community, we mourn. We don't celebrate the life. The traditional Assyrian funeral is a very complex process of different events and different services, and it's not uncommon to see our women wailing or overcome by grief, or to see our grieving family wear black for an entire year to symbolize that loss. And it's something that needs to be kept in mind for our mental health professionals.
Barriers and challenges. Stigmas in the Syrian community. Trust God. Pray more. Your faith is not strong enough.
We all face mental health challenges regardless of our cultural backgrounds, but at times this makes it difficult for us as Assyrians to get the help and support we need because of these stigmas. Assyrians, especially our older generations, view challenges as something that is bad or something that shouldn't be talked about and should be hidden. And our youth have a really hard time understanding why these stigmas even exist. And again, that is why at our youth group we find it so important to create that safe and caring environment where they can turn to their leaders. In the Assyrian community, when someone is struggling or faced with mental health challenges, we're often told, just turn to God and pray more, or that our faith is lacking. Being a Christian doesn't mean that we won't struggle. When we are physically ill, as she mentioned, we go to the doctor and we seek help, and we also pray. We ask that God will heal us. So why is it different when it involves our mental health? Why is it when it involves our mental health do we say, just pray more and turn to God, but we don't encourage them to seek the professional help that they need? When we're sick, we should, yes, pray more, but also go to a mental health professional. Stigmas like these make it difficult for us to say, I have depression, I have anxiety, I am a schizophrenic, I am bipolar, I have an addiction, or even that I am a survivor of suicide. Stigmas like this make it difficult for us to get the help that we need. Lucas, do you want to read the verse?
For I know the plans I have for you, declares the Lord, plans to prosper you, not to harm you, plans to give you hope and a future. Jeremiah 29:11.
Someone very special to me has a very strong relationship with God, but also struggles with depression. And this individual faces all the challenges that come with depression, like finding the proper treatment options or overcoming these stigmas. But every day, God gives this individual the strength that they need to help others who have just begun their journey with depression. God has a plan for us. You know, we're not alone. And just like this individual is able to help other individuals who have just begun their journey, we too are not alone in our fight to end the struggles with mental health and end the stigmas.
Thank you.
Thank you so much, and Jennifer. We have heard from professionals like doctors. We have heard from our youth. We've heard about voting. We got educated on that. I'm going to introduce to you Dina Malek-Moreno, licensed clinical social worker and a co-founder of the Assyrian Wellness Collaborative. Dina has a wealth of experience and knowledge. She has a thriving practice here in the city of Turlock. She used to also work at Stanislaus County BHRS and PEI and Golden Valley. So please help me welcome Dina Malek-Moreno.
Good morning, everybody. Thank you so much for being here today, and thank you to all the presenters, because I'm pretty much piggybacking on everything you guys said today. So I do speak fast. I'm always reminded, so I apologize in advance. I'm going to try to go slowly. So today I'm going to talk about bridging the gap between the mental health services and access for the Assyrian community. And we're going to identify barriers, talk about cultural competency, solutions. I'm going to show you some actual measurement tools that are in Arabic and Farsi that I think should be utilized with service providers. And then at the end, if anybody has any questions for me, just write it down for me, and I'm going to be here until it finishes, and I will not leave until I've answered everybody's questions. We're going to start with cultural competency. So you heard a lot about it today. So Assyrians are in diaspora, and diaspora is when you no longer have a homeland, and you're spread all over the world. And this has a significant impact on our mental health. But I want you guys to know how resilient Assyrians are, because we haven't had a country for approximately 2,600 years. I believe the empire collapsed around 612 BC. And we've carried our culture, our traditions, our language, our dances, and every church that we have, I believe, all the groups for the kids where they learn, and I'm excited for my grandson to go when he turns 5, where they learn to speak and read and write the language and about our culture. But what this also does with mental health is you have parents and siblings that have not seen each other for decades. I have so many clients that are the parents, and they're like, I'm going to die before I see my child. It creates such anxiety, such depression for them, insomnia. If they have blood pressure, if they have cholesterol, it's all going up. So their mental health and their stress, chronic stress, prolonged exposure to trauma, that has a significant impact on their medical conditions as well too. So what happens with the diaspora when they're separated from each other, there's a lot of sometimes hopelessness, there's a lot of unresolved grief, there's a lot of complicated grief. They're missing out when somebody passes away. They can't be there to show their respect, which is huge for our culture. So this is very important to understand. Migration. We come here in different ways. I personally came here as an immigrant under political asylum just before Khomeini took over. So I have more happier memories when I was in Iran. So I was blessed that I didn't get to experience what fellow Assyrians have in Iran, Iraq, and Syria. But I work with a lot of refugees. And when you're a refugee, you're coming because you're fleeing for your life. You literally leave with the clothes on your back. So whether you're educated, this, that, and the other, if you're lower socioeconomics, you walk through the door as equal. And this is very traumatic for them because they've had, like I said, on number 8, generational trauma. So they come to this country with so much trauma. They've had prolonged exposure, generational, and they don't even know. It's like been normalized. Their symptoms has literally been normalized for them. So yes, lack of self-awareness is huge because they've lived with their conditions for so long. Faith is very important to us. As mentioned, we go to our priests, our pastors, they're our number one, our communities and our churches, but also it is a double-edged sword because if I just fast enough, if I just read the Bible enough, you know, sometimes it's, well, why is God doing this to me? Because what happens with mental health versus medical, everybody personalizes having a mental illness. Nobody's complaining when their arm is broken, when their tooth is hurting, when they have blurred vision. They know exactly what they need to do. But with mental health, it's, I'm being lazy. We have these words in Assyrian, that if I can burn them, I would, because it's about being, you know, they're cheshana, they're always worried. Nobody's worried 24/7 for, 10 years in a row. You know, they're always depressed, they're always down, they're always negative. So they really normalize and personalize the symptoms, not thinking that it's a psychological distress, or I call it an illness, but I like that one better. So thank you for that today, and much more. So that's an issue as well too. Language barrier is an issue because depending on what region and country you come from, Assyrians speak Farsi and they speak Arabic. Some speak both, but they speak multiple. But that's important to know as well, because language barrier, when you're going to get services, oftentimes you're relying on your family members. They should not be interpreting for you. We should not, in my private practice, 99.9% of the time, I will not use family. And I let them know, you need to have an interpreter available, you call your insurance company, because I want them to have their privacy. It's HIPAA. How are they going to be vulnerable with me and just tell me, well, I'm trying to build rapport when I have a family member there. And they're not going to tell it to me like, like the person is. Because I remember this when I worked somewhere else, and I worked a lot with Hispanics, or I had a lot of Persians that came in, Iranians that spoke Farsi, but I still remember it. I can't speak it, but I can still remember the words. And even when they would use their interpreters, their family members, I would see that they're not telling me what they're saying. So it's like my shoulder hurts, and I'm having shooting pain. This is happening, and the cousin or the relative with a child who's frustrated because they had to take time off of work without pay, it's like their shoulder hurts. They're just complaining about their shoulder hurting all the time, but they miss all the other things. Same thing with mental health. They're just frustrated all the time. They're just sad all the time. So having interpreters is very important wherever we're at. Mental health awareness, there's just a lack of it. Because we come from countries that we're not blessed where we have Each Mind Matters and stamp out stigma. And so it's, you're crazy if something is happening with you. So they keep everything inside. There's a lot of secrecy. There's a lot of shame. So just lack of awareness. And when you've lived in a country where there's constant discrimination, persecution, and war happening, I'm not saying they didn't have a little bit of good times in between, but you have a lot of stress and trauma. They're not aware that they're developing these disorders, and they're living with them for years. I had a client that had OCD since she was a kid, and this person was well above their 50s towards the end of it, and had no idea. And I couldn't believe, once I educated her about the symptomology and how it developed, she started to recognize it, and she started to stop. She used to use the tools that she was learning. I was just so proud of her. And I feel like I get emotional every time I talk to my clients because I can see them, and you just see them heal. All they needed was a chance and self-awareness. So that's very important because the language is key in all this. Trust. The cultural influences on family dynamics. We talked about that too, which is, a lot of times the family we're raised about, especially for the women, you don't want to embarrass the family, you don't want to shame the family. What you present in the community is very important, very performance-driven too. And so with the dynamics between the male and the female, all those are very important to understand and be aware of. Oftentimes if I have the husband and the wife come in, I'll tell the husband, due to HIPAA and confidentiality, I'm going to need you to sit outside. Would you like some water? And as soon as I'm done, we'll come and get you. We'll let you know when it's time to make an appointment again. So I think it's very important that you're aware of these issues. Be very respectful, polite, and kind when you're talking. But those boundaries are important because we're modeling, especially as mental health, we model boundaries. So if I don't show them to you, how are you going to have them for me? And then the trust is very important. We come from countries as Assyrians where there's a lot of persecution and discrimination historically. So not trusting the government, not trusting, when service providers are there to help you. One of the first things that amazes me when people come and I would say, sit on my couch, it's always like, can I ask you something? They're very timid. I'm like, sure. And they're like, can I still get a driver's license? Am I going to lose my job? This is just because they're here talking about their mental health. Are they going to take my kids away? Am I not going to be able to get my citizenship? So there's a lot of fear, and we've been taught to just, like don't say anything. There's some key phrases we've been taught. And so even me being here as long as I've been, since 1978, just aged myself, but that was taught to me as well too. So that's important to understand too, the ability to build trust. I wish law enforcement was here, because I don't think they're here yet, because I've worked with a lot of Assyrians that they have just been picked up by law enforcement, interrogated months on end, jailed for no reason. So when they see law enforcement, with trauma you have fight, flight, or paralyzing fear response. And whatever that response was back then, that's what they're going to give you. So it's important to understand. I always tell people, it's like, here's Dina, and here's my symptoms. So if I'm not self-aware, you're not ever talking to Dina. You're always interacting with my symptoms. So it's very important for people to know, because, we personalize mental health. And then the generational trauma. So one of the things I want you guys to understand is, when we're coming here, we have grief around losing our loved ones, breaking up of the families, loss of culture, physical violence that we've witnessed, religious persecution, discrimination due to being a minority group, witnessing terrorist threats and war, deaths and atrocities, chronic stress, kidnapping and murder of loved ones. The things that I've heard, I cannot believe, what they've went through. And so when you talk about generational trauma, I can think of somebody that it was their family member brutally murdered. Then the next generation, nieces and nephews, like a whole set was taken, they were killed. And then the next generation, I couldn't believe this woman was sitting in front of me, and I'm wondering why she has so many medical conditions and chronic disease and just depressed, And if you're a physician and a practitioner or anybody in the community, you're not aware of what they're seeing, because they're very meek. They're very quiet, you watch their postures, And so that's that. Stigma. So there's various types of stigma. So public stigma is what the public's view is of mental health. So what you see on TV, what is it, What About Bob? That was about OCD, I think. Straight jackets, you're in a psych hospital. So that impacts, so all these stigmas impact the individual, right? And they're being self-aware and wanting to get help. So public stigma, hearing their family members talk. I had a client that, recently was doing very well. But 7 years ago, the mild was there. And the family member was like, they're not crazy. They're not going to go and get help. And so that significantly impacts, this person could have literally died. Them reaching out for help. Self-stigma. You've internalized what the public is saying about you, having a mental health disorder, and that stops you from getting the help that you need. Perceived stigma. That's just fear of being, my friends aren't going to want to be with me, my family's going to disown me, those kinds of things, just the assumptions about what will happen if the loved ones know that I'm struggling with something. Psychological distress, I got to work on that. Label avoidance. They don't want to be diagnosed, because if I am, then something really is wrong with me, right? That's that denial, that internal struggle that we have. So what happens is they avoid treatment all as a result completely, which once again, mild, moderate, severe. I always teach my clients, it's like, look, you got a cold. What happens when you ignore your cold? You have bronchitis. What happens when you ignore it? Well, you're a doctor, you can tell me. And then you get pneumonia. What happens when you ignore your pneumonia? You can die. I said, mental health works the same way. So your panic attacks and your agoraphobia might not physically take you out, but it robs you of your life, right? So I think it's very important to use little analogies and just things that they could relate to, to help them to understand the magnitude of what's going on with them and to normalize it. That's very important. Give them a safe and nurturing environment to just be transparent with you. Stigma association. So this is like when you have a sibling or a child that has mental illness, and you have your own stigma. You have your own shame around it, right? You have your own shame around, oh God, I'm in public with my brother, and he's having his auditory hallucinations, and he's responding to stimuli, he's talking to somebody. So those kinds of things happen too. Which is ironic because I grew up with an aunt who was schizophrenic and didn't know it, and I thought she was the most stable person in my life. If that gives you any idea. And I used to go visit her in psych hospitals. Like, no one ever told me my aunt was sick. And so she would have suicidal thoughts. And later on, I loved my aunt from here to kingdom come. So we always slept together in the room because I loved her so much. So like a few years back, my mom told me, yeah, there was an incident where she left a suicidal note. I thought she killed you and her too. And I came running in the room, and she allowed me to continue to sleep with her for the next 2-3 years in the same room. And I was like, how could you do that? Like, not knowing, she needed some help. And her response to me was like, well, I knew you loved her. So that's that, lack of self-awareness and not knowing how to properly address getting the services they need. Health practitioner stigma, yes. I have a lot of clients who oftentimes feel judged by their medical providers in terms of, well, you're not doing enough, and why aren't you motivated, and I've already let you know what you need to do, but not understanding, unless if you've experienced depression, which I haven't, but when I see it with my clients when it's severe, I'm like, you could just see the suffering in their eyes. It's like there's the eyes of the soul, right? And it's easier said than done. And I always hear that from my clients. And every time I hear that, it's like humbling, right? Because they're just talking about their everyday struggles. So it's important to understand that nobody wants to be sick like that. Nobody wants to be depressed and have panic attacks and have agoraphobia and OCD. I think it's when you've lived with it for years, it's like, here you are, but it's your disease that's really lived your life and ran your life. I have to always remind my clients, I'm like, look, you're 50-something, you're just now coming to me. You've had this since whatever. It's going to take time. It is not going to be overnight. And that gives them hope, right? Because hope is where resiliency lives. Barriers. Language barrier, as we've talked about it, all of us have. So important to have interpreters present, professional interpreters present. They are so frustrated because they want to speak for themselves. And they do not want their relatives to speak for them because only they can speak for themselves. From the A to Z of it all. So that's very important. The way that you deliver your service is going to be very important too in terms of the language barrier. Because I don't know if you have anybody from Stan State or in the colleges here. I would love to see more professionals, more students getting into these programs, right? For the therapist programs, for the MA programs, the administrative in these health clinics, because we need individuals that represent who we are. It's very important. Lack of education about mental health system and resources. So remember, they're coming from countries that they're not aware, because they don't have anything like this, that we have so many service providers and resources in this community and how blessed we are. Stanislaus County is amazing. They've always been innovative and creative, and I think they're the cream of the crop in terms of what they do for their community with mental health. So it's so important to educate them. So us collaborating together is going to be huge in terms of increasing self-awareness. Once with the Assyrian Collaborative, we start to do these presentations with the Assyrian community and the churches, I would see lines of people like lined up to talk to me, and I was like, see, we're ready. We want help, right? And my practice has increased in the amount of Assyrians that I see. People come in, they'll be like, oh, we heard about you through such and such, and we need more Assyrian speakers because I can't be the only one that sees them in the community. Lack of diverse representation, culturally sensitive practices. Once again, one thing I loved about, because I used to work at Golden Valley, the entire organization was built on, with the immigrant population, Hispanic immigrant population. So they're very stacked and staffed with Hispanic speaking. And I saw how they reached them, and I loved it, because I use the interpreter line all the time with my clients. And I always offer them, would you like to speak to somebody that speaks your language? You want to give them that option, And I think when they know that they can build trust with you too, they'll want to stay as well too. But that's very important, is to have that diversity so they can see somebody that can relate to them. Like my daughter's in the mental health field, and she's a therapist too now with the county with a severely mentally ill. And just them knowing that she's Assyrian and she doesn't speak it, Now she regrets it or wants to, but just them knowing that she's Assyrian, she's like, Mom, I just see it. Whether they're Afghani, whether they're Assyrian, but just knowing that she knows something about the Middle East, she's like, it just makes a difference for them. And she really empowers the women. Transportation, always an issue. So one of the things is it creates a lot of distress for them because they want to go for treatment, they want to go for help, but they're dependent and reliant on their family members and loved ones. That oftentimes they're just busy doing their own lives. So what this does is actually magnifies their symptoms because they're not getting the relief that they need and the treatment that they need in the sequences that's best for them. Shortage of mental health providers, that's definitely a barrier. That's when I would love to see the colleges more, recruit more Assyrians, like when they're applying for the program. I'd like to see a lot more of that. Limit or absent screening tools. So you know how we use the PHQ-9s at the medical facilities or the generalized anxiety disorder? We have these measurement tools for mental health, and they're always in English, and later on I'm going to show you that I pulled them up in Farsi and in Arabic. But if you have an interpreter service that you use, we can start to do more of these forms. I had the PHQ-9 in Farsi, but I can't find it now for the life of me, but I know it exists somewhere. But it's important to use these tools because it catches, in real time where the client's at and where they're at, what they're needing. Stigma and fear. So the fear comes from, am I going to be okay? Is this going to be forever? Am I ever going to get well? Am I going to be able to get married, get a job, get a license, get my citizenship? And there's within the family too, the stigmas within the family too. What's family going to think of me? So those are definitely barriers. And just lack of self-awareness. Themselves, they've personalized their mental illness and their symptoms. That's huge for everybody. But I think especially when you come from a country where there's a lot of trauma, you've got co-occurring disorders, and this is the one most common mental health conditions when they're coming in here. They have co-occurring disorders, which means they have, more than just one at a time. So a lot of them will come already with post-traumatic stress disorder, panic disorder, depression, obsessive compulsive disorder, lots of grief, complicated grief, and substance use disorders. So, and they're living with them, not even knowing that they have these issues. They just think that it's just them, these symptoms, I should say. They don't know that these are the symptoms that they're feeling. They really believe that this is just how they operate. And once you start to explain to them what these are, you just see that it's I don't have to stay in this state, So solutions, educate community and providers about culture, what we're doing today. So thank you so much for being here today. This is going to be very important because they don't come from a culture, a country that says, I want to know what you have to say. I want to hear what's going on. And it's okay and you have value. Everything is oppressive because I have clients asking me for peer support, and I always tell my, English-speaking clients all the time about NAMI and they love it. But, we need to see collaborations more because that's where the magic happens. Screening tools in their language, absolutely. That's going to be important because it measures how they're doing, if they're getting better or not. You can catch things. And when you have been living with something for so long and you have no idea it's a symptom, but when you read, it's like, oh, yeah, I do that. Well, how many times are you doing it? You know what I mean? And that's how we're able to identify it oftentimes through the screening tool when they have no self-awareness. Community capacity building, love this one. Teaching them what the resources are in the community because there's nothing more empowering for any individual when they know all the tools and all the resources in their community. Interpreter services, we all spoke that one to death. Insurance companies, they have them. Golden Valley, a 1-800 number, we just pick it up and call. So if your organization doesn't have it, let's figure out how you can have access to have it. So when the client walks in and you're, you have it already available for them. It might take a little longer, but that's how you can really find out what's going on with anybody when they're speaking for themselves. They have to have their own voice. Transportation services, once again, that's important. How did we get them back and forth? A lot of them because of the language barrier and their fear of getting lost and not being able to speak, right? And they're afraid to try to learn the bus system. So I think I'd love to see somebody do like a group where it's like, let's go today, we're going to learn how to use the bus system. and this is we're gonna do this for like 1 week or 2 weeks, And so we can use like nonverbal, symbolic symbolism to help them be creative or created in their language, right? Diversity in providers and staff, this is so important, just to be mindful, when we're hiring and we're looking at, our applicants, and it's not being discriminatory. You're just saying, hey, we want a balance in this organization. We want to make sure that our organization represents what we have in our community. That's all. It doesn't have to be one way or the other, or just a balance. Cultural competent service delivery. Understanding the culture, knowing, when you have a woman that's in your room, give them that privacy to speak for themselves, helping their family members to understand HIPAA and confidentiality, and this is why they need to sit outside, and reading their body languages, so I'll always ask, especially when I do teens, I'm always like, okay, so for the first part, I always need your parents here because I got to get my information from them. But then it's up to you. Would you like for them to stay? Would you like for them to go? And the minute that I see the hesitation, I'm like, oh, you hesitated? Okay, Mom, Dad, can you please sit outside? So I'm modeling that it's okay to have a boundary. So just do it kindly, respectfully, politely. Ooh, and I like this quote here because Albert Einstein started International Rescue Committee. So we have IRC here and we have World Relief, Modesto, and that's where the refugees are coming in and getting vetted from. And he said, we cannot solve our problems with the same thinking we used when we created them. And I just love that because I just thought of my teenager. But so I thought, how befitting is it? Because, he started IRC. And we live in a community that we have two, not one, but two organizations that are bringing in refugees. So I think it's imperative that we know. And when you hire somebody that's Assyrian, that speaks Assyrian and Farsi or Assyrian Arabic, now you've got them tapping into a whole other population. Your Afghanis, the people that are from Iraq that are just Iraqi. So one person that speaks English, Assyrian, and Farsi or Arabic, they're tapping into 3 people. So you're getting more for your money, just saying. Another thing too with cultural competency is when you work with teenagers and their parents, there is such a gap between how we were raised in the Middle East and how we were raised, how we live as kids in this country, right? And I experienced this with my own kids, and I was here since I was 8. And my daughter's 30 now, and we talk about that now. And even my 26-year-old son, he'll be like, now I understand what you meant, Mom. Because they used to call me archaic and make fun of me all the time. And then when they're, I'm cleaning up their messes in all 5, I'll remind them of what I taught them. And so that happens a lot too. So it's very important to be mindful of that. Because even I think it gives the teenager relief when you say, you know what, I understand there's that conflict, that friction with parents, but the parents usually mean well, and they're just so anxious anyways because they've come from anxious living most of their lives. They're so hyper-vigilant and they're waiting for something bad to happen. So when their kids do anything that isn't within the norm of, our strictness, they just, the world is collapsing, and they just get really, really overwhelmed, and then the kid reacts to that. So it's just like this domino effect. So it's just being able to have that capacity to really de-escalate things and take your time and, validate their thoughts and feelings both ways, because that happens a lot with the difference in culture. So I'm just going to show you just a couple of measurement tools. They're online. So this one is the PHQ-9, and it's in Arabic. Okay, well, if you guys ever want to know where I got these from, I can tell you at the end. But if you just Google it, you'll find it. And I would highly encourage you guys to have interpreters, hire them to make the PHQ-9 for you in Farsi, because most Assyrians speak Farsi and Arabic too. And then these are just resources. We all need to know about the suicide hotline, 24/7, 988. California Warm Line, that's the numbers right there for you. And you can call them when you're in a crisis as well too, or you want to get some resources in the community. Same thing with the crisis line. Somebody can talk to you 24/7. The crisis text line, you can text somebody. And I did this myself just to see if it was real. And it was like a 2-3 minute conversation that I had to reassure them that I was not going to hurt myself. I was like, I promise you I'm a presenter. I just want to make sure it's legit. So they respond fast. I loved it. Let's Recover, I just found out from when I called the Warm Line myself. And that's about drug and alcohol treatment. You have access to calling them as well. friendship line is for seniors whenever they want to talk 24/7. But all these, it would be so amazing to have somebody that speaks, Assyrian or Farsi or Arabic. Stanislaus Recovery Center for your drug and alcohol. We've done a lot of that work with the Assyrian Wellness Collaborative. Because one of the things that happens too, it is that role reversal that happens. In the Middle East, I remember one person, husband worked, and he took it up not just his family, but like 2 or 3 other families. It was just crazy. I don't know how that worked, but I remember it growing up, and we had a nice life. I'm like, I haven't figured that out yet here, but, then they're coming over here, and the women are like, boom, 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 they're picking up. They're learning the language, they're getting their jobs. Some of them are getting their driver's license where they came from a country where for a long time they couldn't drive. And it is depressing the men. There's increased domestic violence, there's increased substance abuse, so that's happening with the men too. And one of my favorite memories with the male client that came in, very resistive by his daughter, older gentleman. And by the time we were done and he was stabilized, he was like, everybody should have a therapist and they should come once a week. And I was like, oh, that's the best thing ever. Because coming from an Assyrian male who does not talk about anything, they're just the provider, that was humongous. That was just huge. So I love when I see the men in there. And they refer their friends, which is cool. So we have the Doctors of Behavioral Health, our psych hospital. And then this is the MAT team, the Behavioral Health, Drug, and Alcohol Treatment Services. You will call them if anybody wants to have an assessment for mental health or drug and alcohol. It's with our county as well. Our county, we're just so blessed. We have so many amazing programs. And I will tell you this, when I work with my clients and they learn about all these different services that we have for them, they're just always like 99.9% of them, because there's always room for growth somewhere, will say how blessed they are to be in this country, how thankful they are for all the services that they provide. And one last thing I want to leave you guys with, if anybody's here from a medical facility, which I don't think they're here yet, the N648 forms are very important. They're for citizenship. So I actually learned through this at first because I was doing it for the Hispanic population. And the N648 is a form that you get assessed, and it exempts you due to your disability. You don't have to be Social Security disabled. It exempts you from disability from taking the reading, writing, that oral exam for the citizenship. So I have clients that have severe PTSD, like it's bad, and panic attacks and their depression. There's no way they're going to sit in a class and learn or retain anything. They're forgetting what date it is today. They're just so, they're so ill, it's not going to happen. So, and I have some doctors that are finally starting to understand what this form is. And so if I had a PhD, I'd do it by myself, but I don't. So I'm collaborating with doctors, I'm explaining it to them. But what's happening with this form is a lot of them, they don't know about it. Some, they're not even doing it. And it's just data entry. So I'm literally typing these forms for them. I'm calling them and getting all their ICD-10 codes and medical conditions. And I don't mind doing it, but that's not my scope of practice in terms of that's what his MA could be doing for him. That's what the secretaries could be doing for them. But they just don't know about it. So I would like to offer to come in and train or have a training where we're teaching them, because this form is huge for anybody that is in a citizen, no matter what your ethnicity is, that absolutely meets criteria, because they will not accept it at the immigration office that does it. And I can tell you in the 5-6 years I've been doing this, I haven't had one denied. Because it's not going to get filled out if they don't meet criteria. But this is important because their stress level, their depression, their anxiety, it is so heightened with this form, because they can never go back and see their daughters that are in Australia, or their mother that's in New Zealand, because they're all over, right? And this citizenship stops it, and it wreaks havoc mentally on them. I have an Assyrian doctor that now he's referring his Hispanic patients to me, because I told him about this when I took my mom to him. I was like, hey, do you know about this form? I will absolutely collaborate with you. So this is very, very important, because a lot of people, they don't know about this form. And you have to meet criteria, and you can meet medical criteria too. So chronic, pain, they have cancer, they have osteoporosis, whatever it is that you can't sit in the classroom, they have issues with gripping, they have their hearing impaired vision. It's important for you guys to know about these forms, because that form is huge. They get their citizenship, they can apply for their disability, they can build their life here. They're not dependent on everybody else and everything else, and they can move freely to see their loved ones they haven't seen for decades. On that note, thank you very much.
Thank you, Dina. That was a very educational presentation. So before we break for lunch, I would like to just remind everyone of how important it is for the Assyrian Wellness Collaborative to continue our partnership. IRC was mentioned today in World Relief. We do partner with IRC, and we have collaborated, and we will continue to collaborate with them. Some of the barriers that you heard today are universal, and I'm sure other cultural collaboratives that with Stanislaus County that we're proud to work with will tell you about these universal issues. So when we collaborate, beautiful things can happen. This concludes our phase 1 of our event today. We're going to break for lunch and come back with Golden Valley, with Yahyabake, and we will have a panel after that with law enforcement and some of our speakers. So please come back and join us, and please give our speakers a round of applause.
Good afternoon. Hi, I hope everyone enjoyed a great lunch. Thank you to the Assyrian Wellness Collaborative for inviting us to connect here and really talk about mental health, because mental health does matter. It's extremely important to talk about it, not just right now, this month, which is Mental Health Month, but we need to talk about it on a regular basis with the ones that we love. We need to have these deep conversations. So today what I'm going to do is, my name is Yamilet Valladolid. I'm the Director of Government and Community Affairs for Golden Valley Health Centers. Golden Valley Health Centers is a federally qualified health center, like community clinics. We have 45 clinics throughout Merced, Stanislaus, and San Joaquin counties. And in these clinics, we have various different services. Our focus is preventative health care. We offer mental health counseling in the majority of our clinics, and we also offer telehealth and telepsych, so people do have access to it. The mental health services that we offer are mild to moderate. There's a tool that I'm going to be sharing with the Assyrian Wellness Collaborative that will be shared on the drive with the different tools for today's event. And it's a brochure that has a program description of what we're going to talk about today. It has a lot of phone numbers that are very important. And it has some really, a lot of tidbits of wisdom around mental health. So really important for me to be able to share that with you all. With that said, I'm going to go ahead and start my presentation. We talked about what our mission was. I think that the presentation did not transfer the way that it should have, but I'm still going to talk about this. Basically, the services that we offer are medical, dental, behavioral health. We offer health education, and we offer various specialty services, including optometry in some of our clinics. We also have nephrology, chiropractic, podiatry. So they're in specific clinics. But I think what's more important is for you all to know where you can go to a community clinic that is able to help you. We accept Medi-Cal, Medicare, Covered California, and most private health insurances. But everyone should know that no one will be turned away, because we also offer what we call the sliding fee scale. We receive a federal grant to assist in our ability to be able to provide services to everyone, regardless of their ability to pay. So the sliding fee scale program, to those who don't have insurance, people just need to bring in a proof of income, last year tax information, and the fee could be anywhere between $35 to $75, but it covers that visit, and it covers any lab work that needs to be done. So I just wanted to kind of throw that out there, that nobody will be turned away based on their ability to pay, their language, if there's language barriers. So what's mental health? I think that that's important, and we've been talking about that today all day, right? So I just have a couple little tidbits. Mental health includes our emotional, psychological, and social well-being. It affects how we think, feel, and act. It truly does. We need to pay attention to our emotional health. Just the same way that we pay attention to our physical health, it's so critical to realize that our emotional health is just as important. It also determines how well we handle stress or stressful situations, how we relate to others and in social interactions, how we make our choices. How we make our choices daily have to do with our mental health and well-being, right? So mental health is so important at every single stage in our life, from childhood and adolescence through adulthood. It's very important to take care of ourselves. Here we go. But what triggers us? What can affect us? So there's various different triggers. It could be abuse, physical, it could be emotional, it could be sexual, it could be neglect, physical or emotional. It could be a household dysfunction, like the way that what we're going through in our household or in our jobs or in our workplace. It can bring the mental illness, an incarcerated relative, substance abuse, mother treated violently, divorce. There's various different stages in our life that can trigger our mental health. And I think that it's important for us to be able to identify when we need help and how to get it, right? So 1 in 5 American adults experience a mental health issue at one point in their life. 1 in every 6 young people experience a major depressive episode. 1 in 20 Americans live with a serious mental illness. So I'm going to briefly tell you about a story. So a couple weeks ago, I did a presentation at a family resource center at a school-based family resource center. There was 26 people in the audience. We were talking about mental health and how important it was, especially around youth. When we started talking about suicide prevention, there was about 9 or 10 people of those 26 that were talking and being very, they were sharing and asking a lot of questions during the presentation, okay? Out of those 8 to 10 people that were talking about, because they were really interested in learning how can they help their children with their mental health, 4 of those families, 4 people, mentioned that their child had tried to commit suicide. 4 out of the 8 that I mentioned that were very engaging. I don't know the rest of the people that were there. There was 26. But 4, a 10, a 12, a 13, and a 16-year-old in one neighborhood. I was very deeply sad and very touched by that and realized that we need to do more when it comes to mental health. My friend runs that family resource center. Day in, day out, she'll tell me about a situation that she has to go and address. Because either the child has been cutting themselves, the child is depressed, the child has been trying to commit suicide. So there's a lot of situations out there. And it's happening right now, today, in our very own backyard. And that's the reason why it's so critical and important. And I want to give you all credit for being here and listening today. Because if we need to learn about what's going on with our community, we need to be aware and we need to talk about it. We need to truly talk about the situations that are happening in order to be able to address them. So with that said, I'm going to continue to share on my presentation, but honestly, this is not, right now I'm talking in general, but this is happening here in our very own community. And so we need to do something about it. And I want to give you all credit for being here and learning, and I ask you that you take this back to your communities and share with the communities the things that you learned today. So, I'm going to talk about ways to maintain positive mental health. First one, getting professional help if you need it. Being able to advocate for yourself when you need that help. If you go to a provider, to your doctor, to your nurse practitioner, PA, and you feel you truly need to be referred to a mental health specialist, ask for it. Tell them, I really need to get some counseling. Can you refer me? Anybody who has any type of insurance has access to that. Please use it. It is offered to each and every one of us. Even if we just need to see, even if we just need to get kind of like a tune-up. Let's learn, let's see, am I having issues? Just so they can use different tools so they can measure our mental health. Okay? Connecting with others. What you're doing today, connecting with each other, being a part of a community. Whether it's joining your church in different groups, whether it's joining a garden club, whether it's going with your neighborhood and organizing something at your neighborhood, but truly, truly connecting with others. Nobody should live in isolation. We need that human touch, that human connection. How important is it? Did we not learn this, especially going through COVID? How important that human social connection is, right? Staying positive. Staying positive, I know sometimes people say, oh yeah, staying positive, so it's hard. No, really truly staying positive, not giving up, reaching out for help when you know you need it. Getting physically active, whether it's going and walking, taking a walk, doing it. Yesterday, me and my coworkers, we already decided every Friday, we're gonna go and take walks at the half of our lunch. All of us together. And it was actually so pleasant. We learned a lot from each other that we wouldn't have probably learned if we were sitting in a board meeting. So it was really, really nice. Helping others. It gives us great joy to help others, right? So that's also a great thing to do. I know we just had Love Turlock, Love Modesto, Love Stanislaus County last week, but we could love on each other every day. It doesn't have to be once a year, right? Getting enough sleep, that's a big one, guys. We need to be well rested to be able to address the challenges that hit us every day. So that's important. We need to be well rested. And develop coping skills. And if you do not know how to develop coping skills, let's read, let's talk about it. Let's touch base. Let's talk to a mental health counselor and say, hey, I need to develop coping skills. Even if it's that one or two counseling sessions with them, ask them. Ask to be referred to a mental health counselor because you really want to learn how to develop coping skills. And there's a couple different ones here. Meditation. Look at that little guy, he's meditating. That does help. It's not just a myth. Seriously, meditation, traveling. Even here in our own county, we have beautiful parks, we have beautiful reserves. So definitely exercising, musical therapy, laughing. We need to laugh more. It doesn't matter if it gives us wrinkles, it's just fine. I'd rather have wrinkles for laughing than for being sad. So definitely. Positive thinking. Thinking, what can we do to change this? If this is affecting me, what can we do to change that? Or if this is affecting our community, how can we all get together and advocate together? So that we have that street light, for example, right? Like, for example, if there's a street light, if people are trying to go take walks, well, let's all get together and advocate for that. So always thinking, what can we do to really empower our community and really increase awareness and make things better around our communities, right? And relaxing with hobbies. That's also a big one. Finding hobbies, whether it's photography, whether it's painting, art, there's all kinds of good stuff that we can get into, right? And I'm sorry that my PowerPoint is taking a little bit longer, but I do have my contact information on there. Basically, what I want to state is that Golden Valley Health Centers, we also offer what is called medical assistant treatment, MAT program. What that is, It's basically to assist for people who have the opioid use disorder. We hear about that a lot, and sometimes we stay really quiet. We want to keep it at home. We want to just tell people, oh, just, you got to take care of yourself. No, we need help. People need help. Let's seek that help. So we have those programs available to the community. This MAT program can help people recover from opioid addiction through a combination of medication and counseling. So that's really important to know. We also have some really important phone numbers that I thought I had shared on here, but they're not showing up. But on the tools that I have provided to you, we have like the national suicide number as 988. That is one that you can text or call. Share that with others. It's 988. It's so important that people are aware that there's a number that people can call on 24/7. Within this tool, we also have the county lines for behavioral health and recovery services in all the 3 counties that we serve, which is Merced, Stanislaus, and San Joaquin. We have the National Domestic Violence Hotline. If a person is suffering from domestic violence, there's help. Okay? We also have the Youth Crisis Hotline. And these tools are going to be shared definitely in the cloud where this is being shared, because these are important tools that you can share with others. So our Golden Valley Health Centers, like I mentioned, we offer mental health counseling. The way that a person can advocate for themselves is basically asking a provider when they go see their doctor or their nurse practitioner or PA. They just need to go and ask them to refer them to a provider. Please ensure that when you are with your mental health counselor, if there is a language barrier, there's help. We have the language line that we can use. Do not use a relative to translate for you, or someone that you know, or a friend, because this is your session with your mental health counselor. And it should be your time, and it's confidential what you talk about. You need to be open and clear, okay? We also, in some instances, offer what is called Uber Health. So if there's transportation issues, let us know when you call and set up appointments. Our phone number for appointments is 209-722-GVHC, which is 209-722-4842. If you have transportation issues, let us know. Because guess what? Half of the time, your insurance company offers you transportation to these locations, so we can help you arrange for that. And we have some programs in some areas that is called Uber Health. We can send an Uber to go and pick you up. So don't let that be a barrier. And remember that we also offer telephone counseling and telepsych, so you can talk to a psychiatrist as well. So with that said, I am going to go ahead and turn it over to Ms. Carmen Morad, who invited me to this wonderful reunion of people, like-minded people. And we're going to get out and talk about mental health because, again, like I said, mental health does matter. And it's happening. There's a lot of situations that are happening today with our youth, with our adults, with our seniors, with our older adults. And so we need to take care of each other. It's that human touch. It's us being here today. So not just for May, but for the rest of the year, let's talk about mental health. So thank you with that.
Thank you so much. Thank you so much. That was incredible. Thank you so much, Yamila. That was a lot of information. And it's important to realize that a majority of members of our Assyrian community actually do use your services. So I am hoping that our viewers and those who are listening to this presentation will give you a call, or if they need transportation or interpretation, and learn how to normalize the conversation on mental health. Thank you so much. I would like to do a shout out to Assyrian Global Network for covering our program today. And please, for all of you, let's a round of applause for our incredible speakers today. So I am so excited to have our sheriff here today, Sheriff Jeff Dirksey. Don't worry, no one's in trouble. We are truly delighted and blessed to live in a county that pays attention to the well-being of its diverse community. And we are very diverse. When we have our voter registrar office here to help us vote, when we have representation from our insurance companies, from NAMI, for example, for different agencies that were here today. And it's important for us to help one another. And one of the things that we do with the Assyrian Wellness Collaborative, under the leadership of our chair, Mrs. Janet Atanus, we reduce stigma, which is what we've done here today. We make sure that everyone in need of services has timely access to care. And I believe we've done that. I believe we are going to continue to provide this information to our community. Without further ado, I'd like to invite Sheriff Jeff Dirksey to join us here. He goes above and beyond when it comes to addressing the issues of our county, especially the Assyrian community. Welcome, Sheriff.
Hi, Carmen. Am I sitting or standing?
Standing.
Oh. Okay, well, thank you,
Let
Carmen.
me put this on. Oh, you already have one.
Yep,
okay.
they gave me one. Do I need to hold this then? Yeah? Okay. Well, thank you. Thanks for having me. How much time do I have, by the way?
As long as you like.
Okay. So I'm going to talk a little bit about mental health kind of from my perspective as the sheriff. I will tell you that the vast majority of the folks that we interact with on the streets in a law enforcement capacity have some sort of mental health issue. And I tend to lump together addiction and mental health with no disrespect, but that it's just for the purposes of this conversation. We'll just refer to both addictions and mental health as kind of the same thing. And just the vast majority of the folks that we engage with have one or the other or both. And while I am not an expert in that, it is a bit of a chicken and egg type of conversation often, which one comes first, and then that can create the second one. And it can manifest itself from our standpoint in many, many different ways. It could be in domestic violence, it could be in homelessness, it could be in gang activity, obviously drug activity. Mental health can just come up in virtually any type of scenario that we deal with. Not all, certainly, they are not all synonymous, but in virtually any type of scenario we can have a mental health challenge that we have to deal with. And that is tough. From our perspective, we are kind of a black and white type of profession. The law is either broken or the law is not broken, right? We're very data or fact centric. What was the show? Just the facts. What?
Just the facts.
Yes, exactly. And from our standpoint, a law can still be broken by someone with a mental health condition, and that is, at some level, from our standpoint as that street level law enforcement, that does not come into play, right? Because the law can still be broken. That the appropriate time for that type of situation would be in a defense, right? So if they are arrested and they are prosecuted, then their mental condition may be an element of their defense, as in they're not competent to stand trial, they can't have logically committed that crime because of their mental status. But from our standpoint on the street, it's not necessarily something that we base our actions on. Again, if the law is violated, it's violated regardless of the mental status. However, we have to deal with those people, and how we interact with them is something that we could spend probably the next 3 years talking about, because it is a challenge, and there is no other way to put it. Obviously, let's kind of start with the law enforcement folks. We obviously come from a variety of backgrounds and experiences ourselves, right? We grew up rich, we grew up poor, we grew up white, Hispanic, black, Asian, whatever the case may be, and all of that forms who we are. And we come with our own baggage. There's no other way to put it, because we are human beings, and until we are replaced by robots, which I don't think is going to happen anytime soon, that is simply a fact of life, and we have to address that internally. We do all of that through training. Now, the sad truth about my profession is that training often lags behind what's happening on the street, right? So we have to see a trend, identify the trend, study the trend, learn about it, and then develop training plans to address that. And that can take days, weeks, months, or years. That's just kind of I don't know how to do that any faster. So we address that with training, and it starts in the basic police academy. There are many hours that are committed to mental health, addictions, dealing with people with that, the cultural aspect, and remind me, Carmen, to come back to that, because it's kind of its own separate piece. But we spend many, many hours preparing for that. And then we train throughout our careers. We do have mandated semi-annual or annual, biannual training that we have to complete that does often cover things like mental health, crisis intervention, etc. And then probably more importantly for those cops on the street, it's those virtual daily interactions with someone that has one of those type of situations. The challenge that we face, and it is difficult to replicate in training, is that a lot of times those situations, they don't occur in an environment like this that is relatively sterile, right? Or clean, well lit, comfortable, right? They often occur somewhere else, behind a building at 2 a.m. with poor weather, no prior knowledge of the person, whatever the case may be. So that training component, though regular and ongoing, it is very difficult to replicate some of those real world scenarios that we deal with. And kind of on the other end, we are always judged after the fact. As to, in this type of environment, we're judged after the fact. So that is the simplest version of the law enforcement kind of experience with that. We at the Sheriff's Office, we mandate people actually get paid to go to the school, and then they get paid once they've completed it. They can get kind of, it's not a promotion, but it's a pay increase for certain specific classes that focus on either addictions or mental health. DUI training, driving under the influence, and it's not so much the enforcement aspect, it's recognizing the indicators of someone being under the influence of either alcohol or some other drug. Call it 11550 training, which is specifically under the influence of various drugs and narcotics. And then crisis intervention training. And that one is specifically focused on the mental health aspect and how to recognize people that are going through a mental health challenge or episode. The problem that we have is when we now start talking about the people that we interact with is that the majority of the time we have no idea who they are, right? So we encounter them, outside of a building at 2 a.m. or in an alley at 3 p.m, whenever the case may be, but we've never seen them before. Now, over time, cops can often develop that's going to be Bob, or that's going to be Sue, or whoever, right? We do deal with folks regularly and consistently, and you start to understand what their specific challenges are. But when we interact with them, we have to try to figure out what it is that they are going through. And we don't care about things like, is this person schizophrenic or bipolar? We can't make that diagnosis. We don't have that training. We don't have that setting. I'm sure a lot of folks in here know Dr. Phil Trumpeter, and a longtime psychiatrist. Yeah. In all of this world, and I asked him, and we had a cup of coffee, and I was talking to him about it. I said, how long does it take you to diagnose somebody's specific mental health condition? We'll say it's bipolar, whatever. And he said, it could be 3 or 4 sessions, and again, in a clinical setting where he has various data and feedback. I bring that up because we don't necessarily care what the mental condition is. We just need to understand that they are having one, and then try to connect with them in the right way. So some folks, maybe you have to be I don't want to say more aggressive, but more direct, more forceful. Or some folks you have to talk much quieter and slow and try to get them to come down. So when you take kind of the two sides of that coin, the person that we're dealing with and then the cop, there is a lot in there that has to be addressed over time so that we have correct responses. And again, that doesn't mean that they haven't broken the law. It just means that, and we may still have to take appropriate enforcement action and arrest and so on. But it's trying to gain their cooperation in a manner that de-escalates and gets them into handcuffs or into an ambulance or whatever the case may be, so that they can receive some service without creating a bigger problem than what we responded to. And I will tell you that the vast majority of the time, we are very successful at that. And that those are not the cases that you read about in the news, because that happens daily, all the time. It's probably happened 5 or 6 times already today, just since our day shift started at 7 this morning. But then there are occasions that go very sideways for a variety of reasons. And obviously that is specifically what we are trying to avoid. So there is a lot of training around that. And I want to pivot a little bit and talk about some cultural stuff, which I understand was kind of discussed earlier today. Yamlet, I don't know if that's what you spoke about. I got here late. It's been a busy day. Okay, but cultural, cultural impacts on our interactions. So our community is diverse, right? We have white, black, Hispanic, Asian. I'm probably missing a few other, what's Assyrian, yes. And all of those cultures come with unique aspects to them that a lot of my folks understand and some don't. We have to work on that relationship. And it is settings like this, or coming to an Assyrian festival, an Asian festival, an Indian festival or event. It doesn't have to be a festival, a church service, whatever the case may be. That is where we break down all of those barriers so that people can understand each other. Some of you may remember post 9/11, right, or like immediately post 9/11, a lot of folks in our Sikh community across the country were getting attacked because people thought that they were Arabic. And it's not appropriate to attack Arabic folks in that setting because of what happened. That was, a crime, an attack committed by a very, very minuscule section of that population. But it's that lack of cultural understanding, and that wasn't necessarily by law enforcement, but just by the community in general. So every time there can be those interactions, that's how you break down those barriers. And with that, we also look at a lot of training around that specifically. Was it last year? Yeah, it was about a year ago, we started getting a lot of Afghani refugees that were coming to our county. And it, through my official emails and so on, right, that was brought to our attention. And we reached out to, I don't even remember the organization that we worked with, but we actually created a training video because there have not traditionally been a lot of Afghani folks in our community, right? We've kind of talked about the ones that we have. But what we wanted to do was create a video for our team, for our deputies, to understand if they came into contact with these refugees, who they were, what language they spoke, because I can't tell you if I hear them. I know I don't speak it, but I don't even know what language to request if they can't communicate in English. So we wanted to educate them on that, on their cultural traditions. A lot of our ethnic communities or cultures can be very patriarchal. So some of you know I spent a lot of time in the military, and I was in Iraq for a year, and we had a lot of training around the fact that if you interact, don't necessarily approach a female, because in that culture that could be disrespectful. So they wanted you to approach the males, try to identify the head of the household, and then interact with them, talk to them, figure out whatever was going on, why we were there to, whatever we needed to talk about, but do it in a culturally appropriate way. That's what we tried to do regarding our Afghani refugees. And as far as I know, we've not had any issues regarding our interactions with them. Same thing, I know Annie, what was it, about a year and a half ago when we really became strongly engaged with our local Asian community, kind of during the height of COVID with the attacks on Asians across the country for illegitimate reasons, but related to COVID. One of my deputies, who is Cambodian, he and I were having a conversation in the parking lot, and I asked him, does our local community have concerns about that? Even though we didn't really see any attacks here, at least not that kind of visibly made it to the surface. And he spoke with Annie and other members of the community, and that actually started a relationship between the sheriff's office and our Asian community that sadly had not existed before. Shame on us, but it exists now, so we have addressed that. But I bring that up because when we see these things that are going on, that creates, it's a little bit what I just talked about, that lag time. We identify the problem and then we try to build that relationship so that we can address that, break down those barriers. And now we regularly have staff that attends various Asian events across our community, and it's a lot of fun. My wife goes with me to a lot of them, and deputies go, and they like the food and they like to watch everybody dance and so on. And we do the same thing with our Indian community, our Hispanic community. Obviously yesterday was Cinco de Mayo, and there were pieces of that we were invited to that were a lot of fun, and then there was some drama last night that wasn't a whole lot of fun. But that kind of comes with the territory for us. But what this would be a request that as the sheriff that I have, and I have said this over and over and over throughout my tenure as the sheriff, if you represent a community, a demographic, invite us to something, because that is how we can break down those barriers. A lot of times we don't know what events you may be having. But we would like to, if we can, have somebody there that can just socialize. But that is a very important way to build those relationships. And now, not to pick on Annie, but you're sitting right there, Annie. And, regularly we'll hear from the Asian community. They'll reach out to a couple of our Asian deputies that have really represented that community well. And if there's any issues, it lets us get in front of those and address them. So that's a nutshell. How much more do you want me to talk about? Questions from people?
Absolutely. So you mentioned the Sikh community and as one of the diverse demographics of our community, and being a very peaceful culture that they are with their religion, but they carry.
Karpan.
Can you talk about that a little bit? Because for someone who's not familiar with it, and if they are, for example, they come in contact with law enforcement, how do you handle that? That's the part of competency I would like to know a little bit more about.
Yeah, the Karpan, I think is the official name for that, the knife that they carry. It's kind of a hooked at the end, and I think a lot of the Arabic cultures carry it as well, or a version of it. It's through training that we have to make people aware of that. And it can be quite offensive if you try to take it from them. Now, there are times when we will have to take it from them. If there is an arrest or something, they don't get to take it into jail, right? If we have to, we will. But it was some years ago, 2-3 years ago, there was actually some sort of issue with one of our Sikh communities where they were large folks were coming together, and they were having some internal conflict. But we had to specifically make sure that our team understood. If you look around, a lot of these folks are going to visibly be armed, and we have to kind of make sure that we know not to overreact to that, because that is what we expect them to be doing. And they are truly a very peaceful people. I would actually submit, just without pulling the actual data, that we actually probably have fewer issues with the Sikh community than any other community as far as arrests or law violations. They are truly a very peaceful people.
Thank you, Sheriff, so much. Let's hear it for our Sheriff, Sheriff Jeff Dexy. You do go above and beyond. Personally, I've known you when you were running for sheriff, and now that, of course, your second term. You pay attention to the diverse communities. You pay attention to our different issues that we have had. And I know we will have different ones in the future. So our chair, Janet, has a small appreciation that she would like to present to you.
There you go. Thank you very much. Appreciate it.
Well, thank you. Thanks for having me. My profession is not perfect, that's for sure. Anybody can watch the news and see that, but we try. We try to always be better. We do realize that there are a lot of mental health issues, there are cultural issues that we want to serve all of the people that are in our community. And quite frankly, if you have a community, we have somebody from your community that works for us. And we talk to them too, and they want us to be good ambassadors. So thank you.
It is our pleasure. Thank you for your service.
Thank you.
We also have, if I could ask Jennifer to come up here from St. John's Assyrian Presbyterian Evangelical Church, please. Dina, Malek-Moreno, come up here, please. And also our own Yamilet. And of course, we have two people that aren't here. And we're keeping Dr. Arlene for last because we have some special comments for her.
Again, on behalf of the Assyrian Wellness Collaborative, I would like to take this opportunity to thank all of our speakers, from our doctor, our social worker, all the speakers that came in. It really is an honor, especially our sheriff that left. We have been working with him. Thank you, sir, again. Thank you for your help, for keeping our county safe, and the police and the fire departments as well, Turlock, Modesto, and the rest of the county. We do appreciate that. Thank you very much for our safety. And this goes to St. John Assyrian Presbyterian Youth Group. Thank you for participating. This is wonderful to bring the youth group to this conversation because they are our future. Thank you very much. Appreciate it. Thank you. Yes. Thank you very much. This is Yamelit?
Yes.
Yes. This is yours. We do appreciate for your presentation from Golden Valley. We have worked with Golden Valley in the past. I have worked with Dina, and we have had a lot of your clients with us. We do appreciate everything that you have talked about because you have helped a lot of Assyrians who are part of your program, and they do participate in your medical clinic and your facilities. Thank you very much for your efforts. Appreciate it.
And I just want to encourage, there's a lot of positions. There's a lot of positions that we have in healthcare at Golden Valley Health Centers. And I really want to encourage the community to come out and apply. The more that the staff reflects the community, the better servicers we can all be. And so it's important for us to step it up and us be there and be the providers, right?
Yes.
So thank you for that.
Great.
Definitely.
Together we can make a better community. Thank you. Wow. This comes from my bottom of my heart. Excuse me. But Dina and I have been together for over maybe 12 years now. And she is an awesome person, an awesome provider. An excellent friend, and one of the founders of Assyrian Wellness Collaborative. It is my honor to give you this. Thank you for all your help. Appreciate it.
Thank you, sweetheart.
Wow. These flowers are for our beautiful Dr. Arlene. She is an awesome provider, an excellent physician, with an outstanding personality, and a very helpful young lady. It is our honor to present you with these flowers, and thank you so much for accepting our invitation to come in and to join the Assyrian Wellness Collaborative, because God knows we need all the help we can get. And through these presentations are the ones that we provide service to our community at large. And no matter what nationality we are from, we all need to go see a doctor. A doctor with such understanding, such level of caring It is awesome, and thank you so much for all your services. We do appreciate it.
I appreciate it.
Thank you so much.
If I may say a few words.
Yes, please do.
In closing, I would like to say something extra regarding Dr. Arlene Yahyabake, a young woman who, through her residency and through completing her education, she has never rejected any invitation that we've had from her. One of the programming that we did with the Assyrian Wellness Collaborative was on opioid addiction. It was one of the most watched. It was one of the most run by AGN television. And I have received so many phone calls because your way of explaining something with that cultural component to it, it makes people understand of how important it is to take care of themselves, to do self-care and well-being. So thank you for all you do.
Thank you so much.
Thank you. You know, it's very important to acknowledge everyone who plays a role. These two young ladies have been sitting here all morning volunteering for us. Come on up here, girls. There you go. You guys can go back there too.
Emily and Angel.
Emily and Angel. Thank you. It does take a village, doesn't it? It takes a lot of community. Yes, and we have NAMI representation. If we could have you join us as well. Please come up, ladies. Thank you so much. Thank you, everyone, for your participation and for your input.
Thank you.
This concludes our event here at the Assyrian Wellness Collaborative. Thank you. We'll see you next time.